Hi, my name's Tor, and I'm one of the hospital and community midwives, and I'm just doing this little clip just to talk to you about what will happen in the few hours after you've given birth. So after you've given birth to baby and the placenta, straight away we will try and do skin to skin. So skin to skin is really good for bonding. It releases the love hormone, which is oxytocin. It will also help regulate baby's temperature, baby's breathing, and it can also help with initiating breastfeeding if that's what you're choosing to do, or chest feeding. You might find that your baby is really calm on your chest and that you just have a nice cuddle and that's it. You might also find that the baby starts to bob their head and they start to go down towards the nipple and the breast, and they might try to initiate breastfeeding, and if they do, then that's great and we can support and help you with attachment and position of baby. But you might find that they're just quite happy having a cuddle, laying on your chest. And skin to skin can be done with baby just naked, or skin to skin can be done with baby having a nappy on them, whatever you're comfortable with. If for any reason this can't be achieved, then we do really encourage that your partner has skin to skin, because again, the baby will get the comfort from your partner, will regulate their temperature and will regulate their breathing. And in most circumstances, whether it's a cesarean, an instrumental delivery or a normal delivery, most of the time we really can get baby having skin to skin straight away. There's only certain circumstances where we can't get baby having skin to skin, so there could be a delay. But if there is a delay, that's absolutely fine, because skin to skin is good at any point, whether your baby's hours old, a day old, a week old, a month old. It's really important to have skin to skin and to have that bonding time. So whilst you're having skin to skin, there's a few other checks that we need to do. So we need to check the perineum and the vagina for any tearing. So the way that will be done is just by really gently opening the vagina with usually a gauze or just a sterile hand with a glove, and just inspecting the vagina and just looking to see if there's any tears or there's any grazes. So small grazes and small tears that just involve the skin might not need to be sutured. If for any reason you have what we call a second degree tear, and that's a tear that involves going into the muscle, we do usually recommend that these tears are sutured. So this is done by giving you local anaesthetic and by repairing the perineum. If you've had an epidural, it might be that you don't need to have any other pain relief and that the epidural gives you a good block and a good use of pain relief. But we will discuss with you if we recommend stitching, and we'll discuss with you pain relief if you need to have that. We also always check the back passage, and that's looking for any tears that involve the anus and the anal sphincter. So if for any reason that you did need suturing involving the back passage, then it's always done in theatre and it's always done by a doctor, because that's the most appropriate person to do it. If you do have any stitches, it can be sore when you go for a wee, so we recommend that you take paracetamol, ibuprofen, and sometimes it's good to pour water over yourself when you go for a wee, or to have a shower and to let the water pass over you, and that can help with the sort of the burning or the stinging. And it's also really important to drink lots so that you keep the urine clear, and then it can be less stingy. If you've had an episiotomy, which is a small cut, again that will be sutured usually by a midwife, or it can be sutured by a doctor, and it's usually done in the room. And we usually do exactly the same by using sort of local anaesthetic or using the epidural anaesthetic. And it's really important that if you do have any stitches, that for the days after, that you keep the area clean, you change your pads regularly, and you just make sure that you're drinking plenty. So once we've checked your perineum and we've got you back comfy on the bed, it might be appropriate to change your sheets and get you off any sheets that have got blood or liquor on them. But some women just want to wait and they don't want that skin to skin to be interrupted, which is absolutely fine. We'll go at your pace, whatever you want really. There are things that we need to do for baby, so we need to check your baby. So the way that we do that is we do a top to toe check, so we're literally starting from the head, looking at the eyes, the nose, the mouth, the ears, working our way down the baby, and then we check that the clamp is secure, And then we also weigh your baby with your consent if you're happy to, and obviously that lets us know how much your baby weighs. So we actually weigh babies in grams, and then we'll convert it to you so that you know what it is in pounds and ounces. We also at that point will offer you to have a vitamin K injection or oral drops for you and your baby. So it's recommended that all babies do have vitamin K, but it's totally up to you as parents to decide if you want your baby to have vitamin K. So there's lots of information on the NHS website, and your community midwife will talk to you about that. So another thing that's really important to do after you've given birth is to eat. You're going to be starving. You're going to be so hungry. You've done amazing. You've given birth. So we'll always offer you things like tea, toast, coffee, juice. But it's really good if you've got snacks in your bag. So actually, if you don't fancy tea and toast, you've got snacks that you can eat and you can fill yourself up on those snacks. We also need to check your basic observations. So we need to do your blood pressure, we need to do your heart rate, and we need to take your temperature, just to make sure that everything's great. So the whole time that we're doing this, we're going to be looking at your blood loss. So usually after you've given birth, there's some blood that's there from when the baby's delivered, and again some blood when the placenta is born. So we will be checking blood loss throughout you giving birth and for the hours afterwards, and it gives us an estimated blood loss. So again, if we suture, we'll be looking at blood loss, and we will be checking it really regularly throughout you being up on the labour ward with us. We also will feel your tummy, and we just want to make sure that the uterus is feeling nice and contracted. And it's also really important to go for a wee, because that will help the uterus contract down and start squeezing, getting back down into the pelvis. It takes many days for this to happen, but it does need to contract straight away, and that's why we encourage you to pass urine. You might also find that if you choose to breastfeed or to chest feed, that when you do feed, it starts some contractions as well, and that's just Mother Nature doing what she needs to do, contracting the uterus down. And you might also find that sometimes when you feed, that you have these what we call after pains, and also that you get a little bit of bleeding from that. So we'll just keep an eye on it. And then as midwives, the next thing that we need to do is to compute everything. So we need to sort of register that baby's been born, we need to give baby an NHS number, we need to admit baby onto our system, and then we need to actually document that baby's been born, and then we also need to do some postnatal notes for you and for baby. It's quite a lengthy process, and it takes sort of 20 minutes up to an hour really to do that. So whilst that's happening, hopefully you're having lots of skin to skin and you're enjoying time with your baby. Also in this time, you might feel that you want to have a shower, you want to have a freshen up. Sometimes women feel like they haven't got the energy to have a shower, and that's totally fine. You can have a bit of a freshen up in bed. We can help you. We've got midwives, we've got maternity care assistants that can help you sort of get back up on your feet. I hope this has helped. Good luck.